Pneumonia in the elderly is a common disease that affects the health and quality of life of the elderly. Understanding the causes, symptoms and treatment of pneumonia in the elderly is essential. Pneumonia can affect people of all ages, but the elderly are more susceptible due to their weakened immune systems. Pneumonia in the elderly can be confused, misdiagnosed and treated late, leading to serious complications. So what is pneumonia in the elderly? What are the symptoms of severe pneumonia in the elderly? What is the treatment regimen for pneumonia in the elderly? What is pneumonia in the elderly? Pneumonia in the elderly is an infection of the lung parenchyma, including alveoli, alveolar sacs and ducts, interstitial connective tissue, bronchioles, that occurs in people over 70 years old. This disease originates from the attack on the respiratory tract of agents such as viruses, bacteria, fungi, toxic gases, foreign objects, chemicals, etc. The disease causes pus or mucus to accumulate in the alveoli, promoting secretions in the upper respiratory tract, and can even cause inflammation of the entire lung tissue. Pneumonia in the elderly can occur in one or several areas, such as lobar pneumonia or multilobar pneumonia. Early detection and timely treatment, the prognosis of pneumonia in the elderly is relatively good. On the contrary, delay in diagnosis and treatment can increase the risk of dangerous complications such as liver failure, kidney failure, respiratory failure, blood infection, etc. The risk of pneumonia in the elderly tends to increase during the changing seasons. Causes of pneumonia in the elderly. Causes of pneumonia in the elderly include invasion of microorganisms, fungi, viruses, bacteria, exposure to dust and smoke, including kitchen smoke, cigarette smoke or tobacco smoke, dust from the environment, lack of physical activity, etc. Among them, the attack of microorganisms residing in the throat and nose, especially pneumococcal bacteria and respiratory viruses, is a common cause of pneumonia in the elderly. In addition to the above causes, some risk factors make the elderly susceptible to developing pneumonia, such as weakened immune system due to age. As we age, our immune system weakens, making it harder for older people to fight off viruses, bacteria, or fungi. These are the agents that cause pneumonia. Underlying diseases. The elderly are at high risk of chronic diseases that can potentially cause pneumonia such as diabetes, Parkinson's disease, cardiovascular disease, etc. At the same time, the use of certain drugs to treat diseases can suppress the body's immune system, reducing the ability to fight off pathogens that cause pneumonia in the elderly. Dysphagia. Dysphagia is a common condition in the elderly, occurring due to the ability to chew, secrete saliva, and the activity of the tongue and larynx being reduced due to the aging process. This will increase the risk of food entering the airways causing pneumonia. In addition, the condition of reduced salivation in the elderly also contributes to the accumulation of bacteria in the oral cavity, increasing the risk of pneumonia. Frequent hospital stays. Elderly people are often hospitalized for treatment of chronic diseases or health checkups. Being exposed to bacteria and viruses that cause pneumonia in this environment is also a risk factor for the elderly. Symptoms of pneumonia in the elderly. Symptoms of pneumonia in the elderly are often not too serious, so recognizing signs of the disease can be difficult and can easily be confused with common respiratory diseases. Some common signs of pneumonia in the elderly: cough with dry throat, phlegm, yellow or green, chest tightness, difficulty breathing, worse with coughing, arrhythmia, fever, fatigue, sweating, shaking. Although not common, in some cases, elderly people with pneumonia may experience additional symptoms such as coughing up blood, headache, nausea, vomiting, wheeze, muscle and joint pain in the body. Is pneumonia dangerous for the elderly? Pneumonia can be dangerous to the health of the elderly if not detected and treated promptly. In the early stages, pneumonia in the elderly often develops silently. Therefore, in most cases, the disease is only detected when the condition is serious or accidentally detected through routine health checkups. This has increased the risk of causing dangerous complications such as pneumonia. Bacteria can spread into the bloodstream to other organs, leading to the risk of organ failure. Lobar atelectasis due to bronchial obstruction caused by phlegm, lung abscess, pleural cavity infection. In addition, when pneumonia is not completely treated, the elderly may experience additional complications of pericarditis with a high risk of death. Diagnosis of pneumonia in the elderly. To make an accurate diagnosis of pneumonia in the elderly, the patient needs to undergo a direct clinical examination with a doctor and perform some paraclinical tests. Clinical examination. During the clinical examination, the doctor will explore and evaluate issues such as medical history, medication history, what medications are you taking and for how long, frequency and intensity of symptoms, cough, fever, difficulty breathing. Assess the patient's general condition. Respiratory assessment through blood oxygen saturation, respiratory rate, and pulmonary auscultation. To have enough basis for diagnosis, the doctor may order the patient to perform additional clinical tests, including blood test. Based on the blood test results, the doctor will observe the number of white blood cells, contributing to assessing the condition of lung infection. Sputum culture test. This test results help doctors determine the exact type of microorganism causing pneumonia in the elderly. Chest X-ray. Large lung parenchymal lesions such as lobar pneumonia can be observed on X-rays, helping doctors accurately diagnose the condition. Computed tomography (CT scan). If the X-ray results are not sufficient to diagnose the disease, the doctor may order the patient to undergo a CT scan. The CT scan results help the doctor determine the exact location of the lung lesion, even if it is very small. Bronchoscopy. This procedure allows the doctor to see the airways in detail and also allows the doctor to collect tissue or lung fluid samples for testing to find the cause of the disease. Through clinical examination and results of paraclinical tests, doctors can accurately diagnose the condition and prescribe appropriate treatment regimens for pneumonia in the elderly. Treatment regimen for pneumonia in the elderly. Treatment regimen for pneumonia in the elderly must ensure two optimal goals: treating the infection and preventing complications. Depending on each case, the doctor may prescribe the elderly to treat pneumonia at home or be hospitalized. Specifically, home treatment. If the disease is in its early stages, has not caused severe symptoms and the patient's condition is assessed as stable, the doctor may consider prescribing home treatment. During home treatment, the patient must strictly follow the medication regimen, return for follow-up visits on schedule and return to the hospital early if the condition does not improve. Hospitalization. When pneumonia becomes severe, the patient needs to be hospitalized for treatment as soon as possible. At the hospital, the patient will receive respiratory support using methods such as oxygen therapy, respiratory rehabilitation exercises, etc., combined with a drug treatment regimen under the close supervision of a doctor. What medicine should the elderly take for pneumonia? Depending on the health condition, age and severity of the disease, the doctor will choose the appropriate medicine to treat pneumonia in the elderly, including antibiotics. After a diagnosis of bacterial pneumonia has been made, the patient will be treated with antibiotics. Based on the type of bacteria causing pneumonia, the doctor will choose the antibiotic that the bacteria are most sensitive to in order to avoid the risk of drug resistance. Commonly used antibiotics include azithromycin, clarithromycin, augmentin, etc. While the patient is taking the medication, the doctor will evaluate the effectiveness of the medication, from which the dosage can be adjusted or another medication changed, if necessary, to optimize the treatment effect. Pain relievers and fever reducers. To support the treatment of high fever symptoms due to pneumonia in the elderly, doctors may consider prescribing some medications such as paracetamol, ibuprofen, Advil, Motrin IB, aspirin. Expectorant increases the ability to eliminate inflammatory fluid in the lungs. Note: in all cases, the use of drugs to treat pneumonia requires a doctor's prescription. Using antibiotics or pain relievers without consulting a doctor can be harmful to the patient's health and even life-threatening. How to prevent pneumonia in the elderly. Pneumonia in the elderly can be prevented by: keep the living environment airy, clean, with little dust and animal hair, and avoid using artificial fragrances containing many chemicals. Avoid crowded places to avoid respiratory infections. If you must go to public places, the elderly should wear a mask, avoid contact and keep a certain distance from others, especially people with lung diseases. Ensure daily oral hygiene. Wash your hands frequently with soap, especially immediately after returning home from outside, before eating and after using the toilet. Exercise regularly to improve resistance. Build a scientific diet. Balance nutrient groups, including issues such as drinking enough water, eating lots of green vegetables and fresh fruits, limiting canned foods and dishes containing lots of fat, salt, sugar, etc. Keep your weight at a reasonable level. Have regular health checkups at least once every 6 months at reputable medical facilities. No smoking, no drinking beer or alcohol. Get vaccinated against pneumococcal and influenza. The elderly are at risk of immunodeficiency due to influenza and pneumococcal pneumonia. The Ministry of Health recommends that everyone, especially the elderly, should get vaccinated against these two vaccines to strengthen the body's immune system to help fight against the agents that cause pneumonia. Currently, people can get pneumococcal and influenza vaccines at reputable medical facilities to prevent pneumonia. One of the safe, quality, and reliable vaccination addresses that provides this service is the VNVC Vaccination Center System for children and adults. When coming to VNVC, people will be examined and screened for free, experience a safe and economical vaccination process, using vaccines that meet international standards from the US, Belgium, the Netherlands, France, etc. Elderly people need to exercise to improve overall health to help prevent pneumonia. How to care for the elderly with pneumonia at home. The following notes will help optimize the treatment of pneumonia in the elderly as well as prevent the risk of dangerous complications. Strictly follow the medication regimen. Patients need to ensure that they take the medication prescribed by their doctor. Specifically, do not arbitrarily stop taking the medication, change the type of medication, increase or decrease the dosage without consulting a doctor. Increase water intake. Drinking plenty of water helps dilute phlegm, helps clear the airways, and compensates for water loss due to high fever in people with pneumonia. Patients can replenish their bodies with water by drinking juices, smoothies, and eating liquid foods such as soup, milk, etc. Create a clean, airy living environment. Elderly people with pneumonia need to live in an airy environment, with few foreign agents and objects such as smoke, dust, animal hair, and chemicals. At the same time, the living environment of people with pneumonia should limit the use of air conditioning, giving priority to fresh natural air. If conditions permit, the family should equip an air purifier and humidifier to improve air quality to help the patient feel more comfortable. Always observe the patient. The family needs to observe and monitor the patient's health condition, including signs of infection such as fever, dry lips, sunken eyes, difficulty breathing, fatigue, etc. to promptly request medical assistance as soon as possible. Develop a specialized nutritional regimen. Consult your doctor and nutritionist to develop a specialized nutritional regimen, contributing to optimizing the effectiveness of pneumonia treatment in the elderly. Frequently asked questions. Some other questions related to the disease, pneumonia in the elderly. 1. Is pneumonia contagious in the elderly? Is pneumonia contagious in the elderly? Pneumonia is an acute infectious disease with a high risk of spreading at any stage. The disease can be transmitted from person to person through two main routes. Direct transmission. Accidentally inhaling viruses and bacteria that cause pneumonia when in close contact, talking to a sick person, or when a sick person sneezes, coughs, or has a runny nose. Indirect transmission. Through contact with shared objects and personal belongings of the sick person, then touching the nose, eyes, or mouth, leading to infection with viruses and bacteria. 2. Why are the elderly susceptible to pneumonia? The elderly are susceptible to pneumonia because of the following factors. The immune system weakens due to aging. The elderly are often hospitalized, where many people with respiratory diseases are concentrated. Prone to many chronic diseases such as diabetes, cardiovascular disease, Parkinson's disease. Old age reduces the ability of the laryngeal muscles, salivary glands, tongue, and chewing ability due to tooth loss, causing dysphagia, allowing food to enter the airways, leading to pneumonia. Bacteria easily accumulate in the oral cavity due to reduced saliva secretion in the elderly, causing pneumonia. 3. What should elderly people with pneumonia eat? The daily diet of the elderly with pneumonia should prioritize foods rich in fiber, vitamins, minerals, and antioxidants such as green vegetables, fish, nuts, beans, etc. It is necessary to limit foods containing inflammatory substances and preservatives, foods high in fat, sugar, and salt such as fried chicken, French fries, canned meat, etc. Meals should be divided into smaller portions to make it easier for the elderly with pneumonia to absorb. Prioritize thin, easily digestible foods such as soup, porridge, etc. To schedule an appointment for medical examination and treatment at TAM and General Hospital System, please contact. Pneumonia in the elderly is a common disease and is also the leading cause of hospitalization and death in this group of people. Early detection of pneumonia in the elderly will help limit complications, reduce mortality, and increase the ability to recover. When seeing signs and symptoms of the disease, the elderly need to visit medical facilities for appropriate treatment. In addition, pneumonia in the elderly can be prevented by improving the living environment, exercising and building a scientific diet, regular health checkups and vaccinations.
Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.